Hello, I'm Jamie. I'm your RN today. I'm going to be doing an assessment on you. Can you give me your name and your date of birth?
Estering Newman, 9/9/2001.
All right, and where are you at right now?
The Youngstown Hospital.
Okay, and why are you here?
Just for a checkup.
Okay, we're going to do that checkup real soon here. Just tell me what the date is today and year.
November 28th, 2025.
Awesome. Okay, so I'm going to just kind of take a peek at some things. Let's see here. I'm going to have you take your glasses off for me. And I'll look at your eyes. Okay, you have equal pupils, 3, brisk reactivity. Your pulses. Good. Pulses are intact. We have all of them. I'm going to check behind your knees if you can just relax for me. Good. Good. And your femoral ones. Fantastic. Do your brachial. Okay, and your carotid. Okay, and then you can go ahead and put your glasses back on. Thank you. I'm just going to take a peek at your ears. Overall, your ears look good. There's no bleeding, no discharge coming from them. Sorry. Okay, and there's no lumps or bumps when I feel for lymph nodes, and her groin ones I'll leave. Her hair is like, head has good hair pattern, no balding patterns, no circular patterns indicating stress, no alopecia. There's a history of alopecia in the family. Her scalp is nice and round, symmetrical with no flattening. Let's see here. Okay. And then I'm going to check over your skin too, generally here. And there's no moles, nevi, nothing abnormal, no lumps, bumps, and no tenderness. And I'm going to have you stand up and kind of walk in. And her gait pattern is very normal. There's no swaying of the hips, no shuffling of her gait, and no like hip hiking substitution patterns. Let's see here. Posture is good. And there's no scoliosis when we had her bend over to check her spine upon walking in to do all the mobility assessment on the way in. So then now we're going to do your head, neck, and we're just going to kind of look at, we already did your hair. I'm going to look in your mouth at like your mucosa of the mouth, the nose. We already did the ears. So let's see. I'm going to have you open up. Say ah. Okay, uvula is moving fine. Can you stick out your tongue for me? Good. Can you lift your tongue up? All the way up? Yep. So there we go. And there's no sores, ulcers, no discoloration in the mouth. And the mucosa looks normal. It's moist, not too dry. There's no coating on the tongue. And let's see here, head, neck, face. Make sure we're doing this. And your eyes, her sclera, there's no yellowing. They're nice and white. There's no broken blood vessels. And there's no sclerodema and no conjunctivitis or conjunctivi coming out. There is a small history of like having pink eye, but that seemed to be like more of a seasonal outdoor allergy, and that hasn't happened in years, so great. Okay. We are going to jump into, so with your face, I'm just going to palpate your cheeks, and then I'm going to do a little bit of tapping here on your sinuses. Do you feel anything? Nope. Okay. No pain or tenderness? Nope. Okay. Everything looks symmetrical with her cheeks puffing. When she stuck out her tongue, it was symmetrical. And then she's able to feel where I'm palpating. Could you feel deep versus soft pressure?
Yes.
Awesome. Okay. And let's see here. I'm going to have you just follow my finger. She has smooth pursuits, no deviations, and no nystagmus. Follow in and out. And her convergence is good. Everything narrows and then goes back as it should. Yeah, thank you. And let's get your temperature. And we are at 37.1, which is normal. No feet. She's afebrile. listen to your heart and your lungs. And our apical pulse is 70. It's found at the midclavicular fifth intercostal. There are no S1, she has good S1 and S2, but there's no S3 and 4 sounds when I listen. On a normal stethoscope, I would listen with the bell, but this is a cardiology stethoscope, so there's actually no bell because it's designed to hear the low murmur sounds or anything abnormal and subtle. When I'm listening to her lungs, she has good vesicular sounds, nice and clear. There's no courses or rails. Sorry, this side. And she has no rhonchi, no stridor. She does have a history of asthma, but hasn't had an exacerbation in about a year. And posteriorly, everything sounds good. When I palpate, there's no tenderness. Is there?
Nope.
Okay. And there's no unique things that should not be there, like lumps or masses at the lungs. Her chest excursion is normal. Everything's symmetrical, and I'm not hearing any adventitious sounds. No concerns for fluid buildup or anything like that. I'm gonna listen to your belly, and I'm gonna palpate your belly a little bit. Everything's soft. Any tenderness?
No.
Any pain?
Nope.
Having regular bowel movements?
Yep.
Any constipation?
Nope.
Okay. And our bowel sound good, not hypoactive, not underactive and not overactive. She has no high-pitched sounds or bruits, indicating like any gassiness, masses. When I palpate, I don't feel any like enlargement of the spleen or the liver. When I go in like this, I have to palpate a little bit deeper. And then with percussioning, again on the intestinal tract, no masses or extra gassiness, no distension of her abdomen, and no bulges with like umbilical hernia or anything like that. So moving along. Okay. Yeah, moving along. Looking at her skin, I forgot to mention that there's no yellowing or discoloration, no bruising, no petechiae, nothing of that sort. And with your stools, wanted to make a side note. With your stools, are you having any bleeding or anything like that?
Nope.
Okay. What about with your kidneys? Are you, let's talk about your renal system. Any pain with urination, bleeding?
Nope.
Okay. Is your urine cloudy, dark, nothing like that?
Nope.
Okay. And are you going routinely throughout the day or any,
Yes.
What about at night?
Yes.
You're
Not too much.
Just maybe once a night?
Yeah.
Okay. All right. I am going to now have you do a couple muscle tests for me.
Okay.
Okay. And I am going to lift up. I'm going to put my hand here. I want you to lift up your hips. Okay. Up like this. Okay. And then I'm going to have you hold it up. I'm going to push down. Good. Awesome. And again, and I'm going to have you push down. Okay. So that's great. I'm going to have you kick your knee out. Pull me back, and then push me out. Good. Same thing here. Awesome. With your ankle up and down, push. Awesome. Lift me up, push me down. Okay. And then arms, same thing. Don't let me push you down. Don't let me push you up. Up. And up. Good. So she has 5 out of 5 muscle strength on all of her extremities with her elbows and biceps, triceps. She's able to go against gravity. Same thing with hip flexion, knee flexion, extension. She's able to, okay, I'm gonna have you go like this with your wrist. Yep, perfect. And you can, yep. And then her fingers also, each one when you flex and extend and give resistance at the joints, they're all normal, able to withhold resistance and move actively on their own against gravity. And you can also test this seated for more functional against gravity. You can also do it in bed, laying down. When she did her trunk flexion extension, she's able to do those supine and prone with no substitution muscles, no jolting to get it up, just normal, smooth muscle controlled contractions. So 5 out of 5. Pulses on everything, when we reviewed those were also 2+, so normal. When I tested for reflexes down low, I also tested for clonus. There is no beats of clonus. With that being said, I'm gonna have you stand up and we're just gonna test your balance. So I'm gonna have you put your feet narrow like this. Put them together for me. Yep, and then close your eyes. And she has no sway with that. And now while your feet are close together, you can open your eyes and you're gonna walk on a straight line. Great. Really good. So smooth, no ataxic movement, no loss of balance, no risks for falling right now. Neurologically looking intact. I'm gonna have you lay down on this couch here, and then I'm gonna have you slide your shin up your heel. Good. And then go ahead and sit back up. And I'm gonna have you point to, or go to, finger to your nose. So all the way out and then all the way in, okay? And she has smooth pursuits with that. There's no, no discoordination, and she's able to hit the target each time. Okay. So you can have a seat in that chair. Sorry, we'll keep you up front here. I'm gonna have you cover your eye like this. And I'm gonna have you tell me how many fingers I'm holding up over here.
2.
Okay, and then other one.
2.
Did I switch?
2.
3. Okay. So her peripheral vision is good, and she also did the chart to check which she has correctional vision, and with the correctional vision she was able to see the very bottom line with no issues. Well, let's review. I'm just going to look over your chart a little bit more here. So are you seeing a dentist regularly?
Yes.
Okay. So your gum health looked really good. I didn't see any signs of like gingivitis, no like weird odors, no bleeding at the gums. Your lips look full, not dried. The borders of them are normal, no swelling. And her throat also with no tenderness, no swelling, or lumps, goiter, nothing like that. Her lymph nodes felt good at the very beginning when we palpated, not enlarged. And there's no pain or tenderness in any of those areas. The mucosa of her mouth was good, as we mentioned. And in her, we're gonna look in her nostrils. And I'm gonna cover just so I'm not blinding you with my light here. There's, mucosa looks good. There's no pink, over pink, and no reddening, no dryness, no bleeding from the nose, no discharge. So her apical pulse was good earlier. All the other pulses were good. I said 2+, and then the only one that we missed was the posterior tibial. So we're gonna just go over that real fast. Great. And in her abdomen, there were no extra pulsations, no enlargement, femoral roots. Let's see. And then we're gonna do, we did our tandem walking test. I'm just gonna do some deep tendon reflexes on you and your, like at your patella, the ankle, and the biceps and triceps. So there's gonna be a little bit of pressure. I'm going to have you hold your arm here, and then I'm going to do a little strike here. Good. Same thing here. Okay. Normal, and then we have good extension when we hit the biceps, so all our reflexes are intact via hip, Achilles. There we go. Okay. And then with the patella, we have a little hammer tool, and we'll go like this and get a little kick out. Okay. When I'm gonna have you hold your hands out for like 20 to 30 seconds and close your eyes, just palm up, and then there's no overpronation, or there's no oversupination or like drifting, ulnar, and then or to the pinky side, and then I'm gonna have you hold your hands out. Yep. And there's no overproning or radial deviations there. For her cranial nerves, we're gonna go over. We already looked at like you have good narrowing or convergence, and then it comes back when we go up more distally. I'm gonna have you smell a couple things. So you're gonna cover up one nostril, And I'm gonna hold this up. How does that smell?
Coffee.
Okay, what about this one on the right side?
Gum.
Good, okay. So kind of sweet.
Mm-hmm.
Awesome. Okay, I'm gonna have you raise your eyebrows, smile, stick out your tongue. Good. Puff out your cheeks again. Okay, everything's symmetrical. I'm gonna tap here. Can you just tell me if that's light or dull?
Dull.
Okay. What about here?
Heavy.
Okay.
Light. Heavy.
Okay. And then I want you to, I'm gonna have you clench down here. Good. Okay, and she's able to clench her jaw nice and tight and move it in a symmetrical way. There's no like shifting or asymmetrical patterns of movement there. Strength feels good on both sides. And then I'm gonna whisper a couple numbers off to the side here. So
2.
okay, good. And then
4. 5.
okay, good. I want you to say ah again. And there's
Uh,
no hoarseness in her voice. She has good phonation. She's very clear. In her speech as well, she's clear, and there's no, like with expression, she's able to express herself, process her thoughts. She has very appropriate thoughts or like emotions and able to be concise. She does not have any emotional lability in her expressions either, and she's also not flat in her affect. So she's presenting very normal. Okay, and then I want you to just lift up. You're gonna shrug your shoulders here and then relax, and again. Okay. So your muscle tone feels good. It's not flaccid, and it's also not like hypertensed. So that's wonderful. You have good strength in your traps, and everything's symmetrical and staying at your midline when you stick out your tongue. So everything's looking very good, Nisreen. Oh, and Nisreen, were you okay that we video record this, by
Yes.
the way? Okay, wonderful.
I consent.
All right. And did you have any lesions or scars?
No.
Okay, I'm gonna take a peek at your nails and your toenails. You have really good capillary refill. There's no clubbing or ridges on your nails. Same thing with your toes. Good capillary refill. And your skin has good moisture. Have you had any issues with dryness since it's winter now?
No.
Okay, awesome. And I'm just gonna check how your skin reacts. So she has good turgor. Her skin like responds back. It retracts back, but not like too fast, and there's no like holding of the tenting. Never like tenting and it holds. So now I believe that we've gone over all this stuff generally with your behavior speech. Do you have any questions or concerns?
No.
Okay. I know that you had a history with skin, like melanomas in the past, and you're doing your annual checkups. Do you have, I see a couple nevi, which is just like normal moles, as you will. There's no asymmetrical borders or discoloration, dark edges, or like concerning edges. The dimensions are fine. Have you had any melanoma recently or lesions that you found?
No.
Okay, and your dermatologist has no concerns?
No.
Okay. And wonderful. And your nail color looks good. There's no like purpling or anything like that, and it's indicating good blood perfusion. Okay. So as far as your like female health is, I know you're going to your OBGYN regularly, right?
Yes.
Okay. And have you had any concerns with that? You have a regular menstrual cycle?
Yes.
Okay. When was your last period?
Yesterday.
Okay. Very concise. Good. Have you do you do any self breast exams?
Yes.
Okay. So when I did her breast exam, she had no hard lumps. There's good symmetry overall. There's no like flattening or dimpling, no edema in the breast tissue, no hardening of the skin spots we had her lay down in different positions. So she had to bend over with her hands at her hips, and she had to go like arms overhead and then leaning to the side. And I didn't see any, again, like asymmetry, no lesions, masses. There's no like skin discoloration in this area. Her nipples are not retracted, nor were they at birth, so that is normal that they're not retracting. We would not want to see them retract. At this point, if she wasn't born this way. And when we do the test to see on the nipple if there's any discharge, she had none. And her nipples are also they're also symmetrical, and no like odd shapes or anything, or discoloration or markings that are abnormal. Let's see here. And do you have a history of breast cancer in the family?
No.
Okay. Well, that is wonderful. I'm glad to hear that. Let's see here. Why can't I find? So just looking for your history, just to look at like any notes from the OBGYN. Okay, and so also with her external genitalia, there was no petechiae, no lesions or bleeding, no like abnormal discharges. No, she said there have been no like histories of intense odors that are abnormal, and no histories of like recent infections or anything like that. No like abnormal blood loss and a regular period. No amenorrhea or anything. And yeah, no pain or tenderness. Okay, wonderful. Okie dokie. Well, I think I'm just gonna review everything, make sure we got everything for the day. But I think that's about it. And I will let the doctor know that you're ready then, okay?
Okay, thank you.
You're welcome. You have a great day, Nasreen. Thank you.